Today's our topic is work with a family having a child with cerebral palsy. The effectiveness of working with a disabled person as a result of damage to the musculoskeletal system is closely dependent on the availability of social, psychological, and medical assistance to his family. According to our observations, all families with children with disabilities with motor impairments can be divided into three groups. First, families within a certain time after diagnosis can achieve inter-family and social adaptation. Second, families that despite efforts and help don't achieve stabilization of behavior. In these families, the correct ideas about the situation of the child, the possibilities of his treatment and developments are not formed. Third, an intermediate category of families, for example, families with deviations in intrafamily and extrafamily adaptation. It's difficult to identify a statistically significant relationship between the characteristics of family adaptation and the clinical characteristics of a sick child. In the adaptation of the family, the personal characteristics of the parents, especially the mother, play a large role. The influence of this factor was convincingly shown in the works of Vishnyovsky and Tkacheva, which describes various types of response to the fact of a disease established in a child. The psychologist of the educational institution has unique opportunities for corrective work with a child and his family. Unlike a psychologist working in a clinic of rehabilitation center, he can meet with the child for several years, observe the most subtle change in his psychological status. To date, there are few studies on working with the family of a sick child. There are almost no studies on the issues of family and family education of children with cerebral palsy, as Mamaychuk et al. Rightly point out. Having a baby with developmental disabilities is a big shock for the family. It's conditionally possible to distinguish several stages of adaptation to this situation. First stage is a stage of shock, aggression, and denial. Family members are looking for the culprits in what happened, blaming each other or doctors. Sometimes aggression also applies to a newborn. The mother experiences negative feelings for him, seeing that he is not like other children. Second stage, some authors call the phase of grief for a desired healthy child who is not. The attitude towards an abnormal child is often deprived of spontaneity. Parents being to realize that they are responsible for it but feel helpless in matters of raising and caring for the children. Seek advice from specialists. Third stage is the adaptation stage. Parents accept the current situation, begin to build a life based on the fact that the family has an abnormal child. Parents often experience a sense of inferiority exacerbated, unfortunately, by the attitude of others towards them and the child, which can be unfavorable. Even if families don't break up, problems of interpersonal relations, conflicts about raising a child, separation of responsibilities for caring for him often arise in them. There are various classifications of types of improper education. One of the classifications distinguishes the following types of improper upbringing. First, hyperprotection. Second, dominant hyperprotection. Third, indulgent hyperprotection. Fourth, emotional rejection. Fifth, hyperprotection and symbiosis. Sixth, education through deliberate deprivation of love. Seventh, education through the call of wild. Thanks for watching.